This is a chlorine wipe that is sterilising the skin so that when we use the needling device, your skin is properly clean and there's no risk of infection. But we're going to start off here and then we're slowly going to move our way around the face so that the areas that we're not doing straight away stay nice and numb. So I'm going to start in this area. The forehead is a little bit bony and it can feel a little bit more pinchy, but we can adjust the sensation depending on how you feel.
Okay.
So how's that?
Absolutely fine, I can't really feel it.
So when we do radio frequency microneedling, we're going over the skin in multiple passes, putting really controlled damage into the superficial layers of the skin. And what that does is give the skin a signal to say that it's broken and the skin needs to regenerate and rebuild itself. So sometimes in the recovery after radiofrequency microneedling, you can sometimes see the little tiny dots where the needles have gone in during the recovery, but they are very subtle and not really that noticeable. So going on here is a mix of injectable grade hyaluronic acid and a blend of 55 different amino acids, vitamins and minerals to really optimise how the skin recovers and the results that you get. It's really important when you have microneedling that the products that are used are of injectable quality. You'll have seen sometimes people doing home microneedling using products that are designed for topical use. And in that scenario, you can have all sorts of preservatives and molecules that are really far too big being pushed down into the skin and into areas of the tissues when they really should never be put. Never mind the risk that is posed by reusing needles rather than just having something that is single use only. So radiofrequency microneedling is an absolutely amazing treatment for textural issues, for tightening pores, for minimising fine lines, for lifting and tightening the skin. The difference between radiofrequency microneedling, which tightens and helps with texture, and something like Neogen, which also tightens, is with radiofrequency microneedling, we can't easily do the eyelid or right round the eye area, which is often an area that people are quite concerned about. And the other key thing that Neogen does, which is so much better than radiofrequency microneedling, is that it reduces pigmentation across the skin. And that's why very frequently when we put together plans and programs for people, we tend to mix and match the treatment so that you get all the hydration and the tightening and the textural improvements from radiofrequency microneedling, but also the pigmentation and the tightening around the eyes that comes from Neogen. Are you all right?
Yeah, I'm okay. I'm joking.
You're actually all right. How's this feeling?
It feels fine.
A little bit pinchy?
A tiny little bit. It's better than the forehead though.
It tends to be better in the areas where there's a little bit more tissue on the bones, and cheeks are nice and juicy. So these needles are all gold plated. There's a little block of 48 of them, would you believe? And over the course of your treatment, we're putting in tens of thousands of tiny little puncture sites, which allows all these wonderful skin boosters and vitamins and minerals to soak down into the skin area, but also tells these cells that they're broken, so they start working really hard to build more collagen and build more elastin. and putting more hyaluronic in your skin, which gives you obviously far greater levels of hydration, which in turn gives you this wonderful, wonderful glow. The other thing we're doing all the time with microneedling is adjusting the energy and adjusting how we're using the needles across the area of your face. So areas that need a little bit more treatment, whether that be tightening or supporting scars, we might do those with a little bit more energy or give our needles just a little bit more depth. So the reason this gives such great tightening and handles the textural issues so brilliantly for the skin is because when the needles are within the tissue, what you can feel in terms of the warmth is radio frequency energy passing between the little gold-plated tips, which gives all the tightening. And also all the wonderful collagen boosting.
How often should I have these treatments, Sharon?
It really depends on what you're trying to achieve and what your goals are. We always would recommend, rather than ever having a course of one thing, doing a little bit of mix and match, because everything will improve your collagen, but each treatment has a slightly different target in terms of what it's actually going to do. Radiofrequency microneedling is a really, really good all-round treatment for tightening and skin texture. But if you've got pigment, then you really need to be mixing and matching that either with Neogen or with laser. It's great to give your skin time to recover properly after every treatment. And so realistically, every couple of months is a great time if you really are trying to transform your skin to come in and do something else. There you go. That is you microneedled. And that's just going to be the end of your skin boosters. We'll finish off that syringe when we take this mask off.
Thank you so much.
There you go. Little